Guys, listen up. Botox isn't just for the ladies. It's a growing trend among men, up to 10% from last year. Dr. Sherry Ingraham with Advanced Dermatology joins us this morning to tell us a lot more about it, and also a demonstration. I will tell you now, you're not going to see any of the close-up injections, so breathe easily. It's okay. Good morning to you both.
Good morning.
And Brooke, you're about to undergo this procedure, so to speak. It's becoming really hot among men. What has changed here, Sherry, with why people are interested in doing this?
You know, I think a couple of things. I think men are realizing that to look young in the job market, to look relaxed, you need to look comfortable and you need to look age appropriate. And I think the women are taking the lead in that regard, and so the men are playing catch up. Also, there's not as much of a stigma attached to it anymore. I think it's in the public, people in Hollywood are doing it, so I think men are feeling more comfortable with it. Also, I've had men say, I don't want to be that man who looks 10 years younger than my wife. So the men are coming in with their wives now to get Botox.
And Brooke, how do you feel about it?
I feel great. People respond to me differently when I have Botox. It's true.
So you've had it done before,
I have.
And you could tell a difference before the way you looked and how people treat you. In what way? What is the difference in the way they treat you?
I don't have. There's no frown. You know, a typical frown is more of a happy expression, and people respond to me differently. They really do. How
interesting. So you find that it lifts your eyebrows a little bit as well.
Notice it clears a lot of the deep lines. I have deep lines on my forehead without it, and it just shows my age.
Well, go ahead and you can go ahead and get started. Sure. Then when is he going to start seeing results from this, Sherry?
So typically we tell patients about 2 to 4 weeks after their injection they will see improvement. And really, when you have deeper furrows, especially in a male where they have kind of hyperactive or larger muscle groups in their foreheads, it's getting that repeated treatment every 3 to 4 months that's going to give them the most benefit, because you want to continue to have those muscles not be active, because if we let it wear all the way off, they start working on the skin again and the line starts getting embedded. So you don't want to wait, as I say, to go to ground zero.
Sure.
You want to get it done and stay on top of it.
And so when we first started, I was only talking to you about the forehead, but it does make a big difference on the side of the eyes for the so-called crow's feet as well.
Botox is FDA approved for the crow's feet as well. And so in men, and this is a really important point, in men we tend to do things a little differently. In women we want to arch the brow, right? A real feminine arched brow. In men, you don't want an arched brow. You want more of a straight brow, as Brooke has here, and you want to maintain that brow. So the placement is a little different. You want to make sure you go to a board-certified dermatologist, plastic surgeon, someone who has a lot of experience, especially in injecting men, because we do a little bit of a different treatment for men.
Okay, you know, I had to ask you what it feels like for anyone who hasn't had it done before.
I just feel an initial prick, and there's nothing else. There's really no pain.
And then are you able to go back to work, or will you need to take a few days off?
It's almost instantaneous.
So you'll be able to.
There's no evidence in about 30 minutes. There's no evidence at all.
Yeah, he may have a little red mark, almost like a little bug bite for about 30 minutes. He can put a little ice on it, go right back to work, and no one should know.
Are you seeing any other type of procedures that the guys are interested in?
Yeah, you know, I always say Botox is a gateway drug. So now the men who are getting Botox are coming in and saying, you know, I want a little bit of filler, or I want some resurfacing chemical peel. So I'm seeing more and more men getting voluma, especially in the cheeks, because as they age, just like women, we lose volume in the cheeks.
All right, well, Dr. Ingraham, thank you for being here. Brooke, thanks for being so brave to be able to talk to us about it and let us see the new trend and what it's all about. It seems pretty simple, and I'm glad it's helping you out in your personal life.